Hi, this is Dr. Bailey, and let's continue with some chart functions. We may have missed some of these previously in the tutorials. I'm going to try to keep it a little more free form, and typically once a patient is loaded into the chart program, I click on the Start button. This allows me to interact with the chart. We will not be able to generate the chart note unless, of course, the Start button is clicked. So let's reset that. First thing, the assistant would probably want to look at the therapy placement, place the therapy accordingly, and then hit the Start button. And then usually when we come in to see the patient, it's around 10 minutes or so. And we review the patient's subjective complaint. They said the neck pain was getting worse, and so we might want to do some more testing, and we could use this. Let's show that the patient had a positive foraminal compression test and add that. And let's take this particular test off since we did not perform it. And let's go ahead and keep the treatment plan the same, and we see that the patient's chronicity is slowly progressing, so let's leave that there. And unless you have any change on the diagnosis or anything like that, once the therapies are complete, we check these. So nothing much gets changed unless you want to update some vitals or change the therapy plan or assessment. So let's go ahead. We manipulated the thoracic region and we performed manual traction in the lumbar region. Now remember, if you perform manual traction, massage, or any therapeutic exercises, they need to be in a region where there is no manipulation. Otherwise, insurance will not cover that. So pretty much, we're ready to generate the patient's chart note. Let's go ahead and do that now. And we'll blow it up so we can look at it a little better. If we need to edit anything in here, we could do so. The chart note is a good place to also put, if I wanted to take a couple of x-rays, I could just go AP and lateral recommended. And let's leave that the way it is, and let's save the note. And let's go ahead and check her out. And now let's go back to the front desk and we'll check her out at a later point. While we're on the chart program, if we wanted to review the patient's x-rays, we could look in under and click on display image. We could look in and look at the x-rays. If we wanted to check any x-ray angles, hold down the left mouse button as you drag this line, and if you'll line up with a with the superior inferior end plate, you could get more of an accurate disc angle. Some other things is turning on the horizontal and vertical snap lines. As you can see, we can move those and see how things line up. We could also go line to line. We could do a little freestyle drawing if we wanted to show the patient where the problem was. Click the refresh button and we'll be back to the x-ray that we have here. Let's click this icon. This will put us back over there. Anything you want to review, you can bring up in the image database, or you could add more images. We could also filter those images to see only x-rays. And there's another one. We could do an inversion and see a little bit more detail sometimes in an x-ray. If we needed to publish this particular x-ray with any line markings or drawings on it, we could click on the Save to Clipboard, and then we could go into, let's say, for example, let's use WordPad, since WordPad will work. There it is. And let's say we wanted to paste that particular image right into WordPad. There you go. And so as you can see, you can export any image in the database that you would like to do. Let's go ahead and close that out. I'm trying to think of some other features that you probably are not aware of. One of them is the phrase maker. Now this would allow you to change the phrase of any procedure that's been added right here into the procedure box. So as you can see, we could pull down joint manipulation, and we can go through the mask and see there are different phrases for that. We're going to need to show you the phrase maker a little more in detail, but we'll have to go back to the front desk program to get that started. I think we did show you the range of motion. It's always going to have the last test you perform, so it's easy to roll over in your next exam. And if you need to update anything, whether it be review of systems or past and family medical history, you can go ahead and do that, and it will be printed into the patient's chart note. Now, we can only edit the last chart note, so I always advise to look at that note before you generate and save the next note. And so any addendums you want to make to the previous note, you could, it's okay to make mistakes. There is nothing wrong with that. If in your future note you want to refer to the past note or a particular date, it would be quite all right to add that down here. You would need to click on the edit button. It'll turn red, and you can edit the note right here. I could just put today's date in this note, and then we could say what we wanted to, right in here. Or we could cancel that edit and leave that alone. Let's see if there's some other things we need to bring up. You are aware that when we double click on the ellipsis buttons, where you see the ellipsis at the end of the label, we can go in here and change. These are easy phrases to add. We'll get to the more complex phrases a little later, but I wanted to show you that there they are, all of these phrases that you can just enter on the fly. And when you generate the note, if you notice you wanted to add something different or change a diagnosis, you can always go back and keep regenerating the same note over and over until you get what you want. Let's go ahead and close out, and in the next tutorial we'll cover making phrases for these procedures, and we'll actually go in and make up a new procedure of our very own and add the phrases to that. Thank you.